Health Watch is presented by UMass Memorial Health Care. Here, caring for you.
Welcome to Health Watch presented by UMass Memorial Health Care. We're talking about domestic violence and the impact it has on children. How common is domestic violence? Can you share some statistics?
So unfortunately, domestic violence is not an uncommon experience for many people. 1 in 3 women and even 1 in 4 men may experience intimate partner violence throughout their lifetime. And so when we're talking about that from the child perspective, that means that every year 5 million kids are witnessing domestic violence.
What are some myths about domestic violence?
There's a lot of myths in terms of, why doesn't the victim just leave? Why does she stay? That there's some kind of weakness there. And in fact, that has nothing to do with it. These are victims. These are people who are from all walks of life. There's nothing common about them in terms of socioeconomic status or in terms of competence. That these are just people who've gotten themselves into situations, and as the numbers show, it can happen to almost anyone.
Do many victims of abuse stay in relationships because of the children?
Many of the victims do stay because of the kids. Many stay because of economic factors. We know that 98% of victims have some form of control being leveraged against them in terms of monetary control. We know that victims stay for a variety of reasons, but oftentimes they're staying because they're trying to do the best for others, not necessarily what's the best for them.
What are some of the common behaviors for children who have witnessed domestic violence?
We can see a variety of behaviors. We can see behaviors from early on. People often say, well, the baby doesn't know. But we can see it in babies. We can see babies who kind of shut down, who are not exploring their environment, not developing the way they should. As kids get older, we see sleep difficulties. We see behavior changes in terms of increased aggression, increased difficulty with schoolwork. Sometimes these kids get misidentified as having ADHD. And as kids get older, older kids have often difficulty with other relationships with adults and kids. And adolescents can have increasing difficulties with the law, sort of that ratcheting up of these behaviors kind of as you go through the lifespan. So it's really interesting that we often look at child behavior and we assign to that child some blame. We say there's something wrong with that child. And I think when we start to see these kinds of behaviors, we need to ask, is there something that's happened to this child? Is there something that this child has witnessed? Because the really interesting fact is that children are developing these behaviors not because there's something wrong with them, but because there's something very right with their bodies. Their bodies are developing mechanisms to cope and to survive. We were meant to live in the wilderness, and so we have all these parts of our body that help us to deal with threat. And when kids experience threat, that sort of starts to get embedded into the brain. The brain is developing in children. So this is the very time that they're learning skills so they can survive. And the skills that they learn in these hostile environments are skills for survival and skills for protection of mom and protection of their other siblings. So those are very helpful skills in the dangerous situation they're in. It's that we misinterpret it when those kids go to school or to daycare or to after-school programs. And we look at their behavior and say, oh, that child's aggressive or that child is misbehaving, when in fact we're not considering that that child has developed behaviors that are completely appropriate for that kid given the threat that they're constantly under.
How can someone help a child who is witnessing domestic violence?
We, as the adults in those kids' lives, leave a space for kids to be able to share what's going on. I think we as adults often rush in and we talk without listening, and we try to put our ideas about what might be going on into the conversation before we let the kids tell us. Making a safe space for them to be able to share is the first most important thing. Also making sure that kid understands that that this is about what happened to them and not what's wrong with them. And once you can create that space where they don't feel like they're at fault and that you're blaming them, then they may have the space to be able to share what's going on.
Are there hotlines specific to helping children?
Yeah, so the hotlines, we have Daybreak, which is a fabulous program here in Worcester through the YWCA, and people can call that program. But what they have access to are all the resources that we have now developed in Worcester for helping kids who've been exposed to these types of traumas. We have a fabulous development of evidence-based therapies for kids who've kind of had their brains develop in this constant setting. And so we can help them so that they don't continue to sort of live under threat and react as if they're under threat. So if we can get the family out of danger and get the child into therapy, they can go on to have much healthier, happier lives.